Good morning, everyone, and thank you for joining us again for our weekly press briefing on COVID. Really glad that you're here. We've got some great panelists today. I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association. I'll start with some opening comments today. First, I don't know if folks saw that the CDC director this morning said she has a feeling of impending doom about COVID. And I don't know if in Washington State we are quite at the impending doom place, but we're certainly in the increasingly worried place. Our colleagues around the country in some places are reporting significant surges, both in cases and hospitalizations. Michigan is an example of a place that the hospitals are getting pretty full, which had been pretty under control until now. So it's definitely concerning. We tend to run behind Europe. We've tended to be behind Europe by about a month throughout the COVID crisis, and Europe's pretty bad right now. So I think we really want to be sure that people continue to wear their masks, keep their social distance, so that we can hopefully stave off this potential impending doom and instead have things continue to get better. In our state right now, we have our cases are kind of going up and down, and they're changing regionally. We had hoped to see more of a decline than we're seeing now, and so that's a little. It feels like it's kind of simmering in a way that we would rather it not. We'd rather COVID be on its way out, and it doesn't feel that way. So I think that's kind of the place. There's always a question in this briefing about sort of how are we feeling, kind of what's our sense. I'd love for the panelists to weigh in on this as well, but I'm feeling increasingly worried, not yet to impending doom, but worried that our national leader feels impending doom. I do want to show a slide that the Washington State Department of Health shared with us last week. I think that I will say that I hadn't had this realization of what they showed, and I thought it was really interesting and discouraging. And also, again, emphasizes the need for continuing to have folks mask and do everything they can to prevent COVID. So this is the ups and the downs of the waves that we're having. And what the red lines are showing is that the lows are getting higher. So we've all been talking about flattening the curve and reducing the peaks, but we also need to get our lows lower. We need the highs to get lower and the lows to get lower. And so I think I hadn't seen this depicted quite this graphically about that we're inching up in a way that we're kind of resetting our baseline and having a normal level of cases be higher than we would like it to be. So if you all haven't seen this graph, this is from Dr. Bob Lutz at the State Department of Health, who's an excellent partner for us. Shared this with us at we have a every other week call with the DOH and all of our members, and it definitely got people's attention. So I wanted to share that as well. Vaccines continue to move along at a good speed. I think we're excited about the phases continuing to open up. We have a new phase on Wednesday. We're glad about that. A lot of states are accelerating phases even faster. I think that's worth considering. We're hopeful that we can get through the next phase quickly and then continue to open up vaccines. We really want to be thinking about how do we build the line for vaccines? How do we get people ready? How do we address and overcome vaccine hesitancy? A piece of something that at the Hospital Association that we are really doing is we're not talking about shots in arms. I don't like that expression because it's not an arm, it's a human being that we're protecting from a terrible disease. So I really want to talk about getting life-saving vaccines to people, not just, to me, it feels very kind of mechanized, like it's a conveyor belt. We're just sticking shots in arms as opposed to we're really providing a service to people that will in fact save their lives or save the lives of people that they love. So with those opening comments, I'll now introduce our panelists. Really great group today. Some of this is based on the requests that you all have made for us about who you'd like to see. We have Elise Cutter, who's the Chief Operating Officer for Island Hospital in Anacortes. And you all had a desire to hear from a hospital that had used Johnson & Johnson to hear about the community response. As we've said multiple times, we believe the vaccines are clinically equivalent. If you look at the data and where Johnson & Johnson was tested, it was tested in Brazil and South Africa. It was effective against variants. It prevented death, severe illness, and hospitalizations. That's what matters. So we're really excited about Johnson & Johnson, and Island Hospital was one of the first hospitals to receive it, and we can talk about that experience. We had the Johnson & Johnson allocation we got it for 1 week and then we didn't get it for 2 or 3 weeks and we're getting it again, I think this week, and then we're not getting it again for 2 or 3 weeks. It's a little bit of a mystery to me about how that's coming, but we are excited to be part of it when it comes. Catherine Kroll is the Infection Prevention Director at Peace Health, and Peace Health has multiple hospitals across Washington, Oregon, and Alaska, and so excited to hear about their work to prevent infections. This is obviously an infectious disease, and we're doing everything we can to prevent its spread. Dr. Daniel Getz is the Chief Medical Officer at Providence Sacred Heart in Spokane, and as you all may know, Spokane had a lot of COVID cases, and Providence Sacred Heart in particular took in a lot of transfers from hospitals in the Eastern Washington region. We're really grateful for that. So Dr. Getz can talk about their current experience. And Dr. Getz, I'm really interested in your perceptions of where are you on the increasingly worried to impending doom scale? And finally, Dr. Jana Friedley, who's the Vice Chairman for Clinical Affairs and Rehab Medicine at UW Medicine. And this is in response to the request that you all made to hear about treatment for long COVID. And Dr. Friedley has been very involved in that. And I will say the prospect of long COVID is another reason to avoid not getting COVID, because as bad as short-term COVID is, long COVID is terrible. So we really want to emphasize to people, this is a real thing. And the way you can prevent yourself from getting long COVID is just don't get COVID at all. So we're excited to hear about the work there on long COVID. So Elise, why don't we start with you and hear about your Johnson & Johnson experience, your vaccination experience generally, and in particular, Johnson & Johnson.
Sure, absolutely. Thank you for having me. Island Hospital received 800 doses of the Johnson & Johnson vaccine the week of March 15th, that first week that it was available. We were very excited about that. And, you know, what we found is some people were very excited to get the Johnson & Johnson vaccine. The idea of having one shot and being done is very appealing to lots of people. And then we had others that it just wasn't as familiar. You know, they had heard about Moderna and Pfizer, and those had been around a little bit longer. So people were a little maybe nervous about getting the newer vaccine. And the statistics had come out that showed, you know, when they compared the percentages for efficacy, that it was lower. We did a lot of work on communicating with our community that it was very effective. And just, Cassie, as you said at the beginning, that it was tested at a different time with different groups of people, and that it was shown to be very effective. And we used your quote that the best vaccine to get is the first one that's offered to you. And we truly believe that. And we had our director of pharmacy present to our board and the public on the different vaccines, how they're effective, the different groups of people that they had been tested on, and the different timeframes to really show to our community that this is a really good vaccine. And we had all 800 appointments filled that week and gave out the Johnson & Johnson vaccine. And now we've actually, now that we don't have it and people are really looking for it, especially when we move to the next phase, a lot of the employers in the area were asking if we had Johnson & Johnson, because they know it's that one shot and done, and their employees had been asking for that. So we have since gotten Moderna vaccine.
And in Anacortes, you had mentioned, I think, that you all have quite a few folks who are going out on ships. And so for them, that's the kind of population where if immediately becoming eligible, if you know you're going to be taking off for 3 months on a ship, like this is a good thing.
Exactly. And a lot of the outreach we did when those folks became available, we partnered with our port to get word out to the fishing vessels, as well as some of the processors that are here in town. And we did a lot of outreach again. We have a whole process in place for equitable outreach to members of our community. So we did all those things to make sure we had all those appointments filled and those vaccines given.
Great. Thanks so much, Elise.
Absolutely.
All right, Dr. Getz, how about you? And let's hear I want to start with your scale of sort of worried, very worried, impending doom.
Yeah, you know, I'm not in the impending doom phase. I felt like that in December, you know, when we saw cases. I think what Dr. Lutz has put together is really an interesting snapshot. And I think there's a couple things that we have to remember when we look at this data. One, the state's vaccinating approximately 45,000 of our highest risk patients daily. So these are patients that have a much higher likelihood to end up in hospitals critically ill. So I think the vaccination effort really puts us in a different spot than we were, a number of months ago. So I think the biggest fear I have is that we declare victory too early. And you see some of the images that came out with people on spring break congregating in the streets together. And of course, that's going to translate to higher infections. One of the other things I think it's important to remember is that we're testing for this disease at much higher rates than we ever have. At Sacred Heart, we're testing everybody upon admission. We're testing 3 days after admission and then another 3 days after that, really to try and avoid people coming in with undetected disease and keep them as well as our staff safe. We're also testing everybody prior to surgeries. And you can get tested now on really kind of any corner, if there's a Walgreens. So I think that's also lending itself to higher rates. But I think what we really have to focus on is keeping people out of the hospital and wave through that as we see increasing numbers of variants becoming more widespread across the United States is really focus on the vaccine efforts. And it's wonderful to see people adopting this at higher rates. I'm thrilled to see the Johnson & Johnson vaccine out. So, I think we're in a little bit different spot than we were earlier in the pandemic. We know more about the disease. We have a way through it with these vaccines. They're becoming more and more attainable by the day. So I'm cautiously optimistic, but I think we can't let our guard down. We have to keep pushing the message that we still have to be masked. We can't be congregating in large settings. We have to do all the things that we have been doing to keep the infectious rates from skyrocketing. And just, we're close, but we're not there yet.
And Dr. Getz, one of the things that we have heard people say is like, oh, it's not so bad. People can be treated now. There's treatments available. And I think it's helpful always to remind about people are still dying of this disease. So maybe you could talk about what treatment is better for sure, but there's not a cure.
Yeah, it's a horrible disease. And we don't, although we have therapies that help reduce the potential severity of disease, there's lots of people that still have horrendous outcomes and die from this disease. So, I think what we have is a way to prevent it that's highly effective in the vaccines, but even the therapies that have been studied the most rigorously, the number to treat's high. You have to treat a lot of people to see one person get a positive benefit. And we don't have a magic bullet that eliminates this disease. And as was mentioned earlier, it's not just a disease that's horrible in the acute setting where people are on ventilators for weeks and weeks at a time, or even having on, heart bypass machines. But, those people that have long haul symptoms where they're sick months and months and months after they've recovered from that acute phase, it's issues down the road potentially with people having problems with memory and fatigue, and it can cause depression. All of these different things are impacted by it. So the best course is to keep people from getting it. Absolutely. Although we've certainly seen declining rates of people dying from it in the hospitalized setting as we've gotten better dealing with disease, it really hasn't augmented the course of illness, and that this is just a horrible disease for certain people.
Thank you. I think an interesting statistic as we look around the country is that the rate of disease and hospitalization among the folks that were first prioritized for vaccinations, healthcare workers, and folks over 80, over 75, over 70, those rates are really declining significantly, which is showing that vaccine is working, that the states that are having a surge are seeing it in younger patients. They're seeing it in their, sort of 25 to 40-year-olds seem to be the big area for surge. So it's really, I think, proving that the vaccinations are working, even with the variants we have circulating.
Yeah, the sooner we get everybody vaccinated, the quicker we'll have herd immunity. That's really the solution for this. And so I'm thrilled to see that the media is taking a larger role in promoting the safety of vaccine. The scientific data out there is clear, and this is very safe and incredibly safe compared to the potential risks of getting COVID. And so I can't be happier in seeing these folks that are over age 65 getting vaccinated in higher numbers, because it is translating to fewer people ending up in the ICU.
Thank you. All right, Catherine, let's hear about Peace Health and your work to prevent your infection prevention work.
Yeah, like Dr. Getz, we're really excited about the role of vaccines. In the healthcare setting, our goal is always to make sure that if you don't come to the hospital with an infection, that you don't get an infection. And if you come with an infection, you don't spread it to others. And so in doing that work, it's been incredibly important to identify on the front end who has COVID. And as we've learned about this disease, we've really seen that the best strategy has been a testing strategy for everyone who's coming into our hospital, and then testing them again a few days after admission. Right now, we're testing on day 5 after admission and weekly thereafter. That way, we can identify people who might be coming in with the virus for something like a broken leg and not realize that they're incubating it, and prevent them from being placed into a room with someone who they might share a semi-private room with, or from having aerosol generating procedures that might put the healthcare workers at higher risk. We're also really excited to see so many of our community getting vaccinated and the uptake of this, because as we vaccinate people, we reduce the number of susceptible people in the population. And when you reduce the number of susceptible people in the population, that slows the spread. We're not feeling the sense of impending doom that the CDC director spoke of this morning. We're feeling cautiously optimistic that our hospitalizations have leveled out. We are certainly concerned that as we open back up, that we do so in this phased setting, and that we not go from having very minimal socialization to large gatherings where people are susceptible to the virus. We know that most people who get the virus get it from spending close contact with other people, and often that happens when the other person is mild or asymptomatic, and so you may not even know that you've been exposed. So it's that importance of staying home when you're sick, but also protecting those around you when you're out and about, even if you're feeling well. In the hospital setting, as we've worked to keep our healthcare workers safe, all of our healthcare workers have been offered immunizations. And the CDC actually just came out this morning with the Morbidity and Mortality Weekly Report showing the effectiveness of vaccination in healthcare workers. And we are certainly seeing that in our healthcare workers. And we're really thankful to give those folks who are at the front lines fighting this virus the opportunity to be protected from it.
Thanks so much, Catherine. It's great. Do you have a sense of what the take-up has been for vaccines across Peace Health, of your healthcare workers?
Yeah, we're really excited to say that we are well above the national average on our uptake. The most recent numbers I've seen were 76% of our healthcare workers had taken it. And then we were going back to those who maybe were hesitant early on to be the first ones to get it, and going back and re-offering it. And we're seeing uptake among those who are seeing their colleagues protected as well now.
Great, thank you. We've had on this briefing before Dr. Peter Rutherford, who's the past chair of the association and the CEO of Confluence Health in Wenatchee, and he was in the I think he was in the Pfizer trial, and he might have been in the Moderna trial, but he was in one of the trials, and he didn't know which vaccine. He didn't know whether he got the vaccine, but he did get it. He found out recently that he did get it because he's now eligible by phase, and so he said he's been talking about that a lot. That he got the vaccine, I think in July or August, and he keeps saying, I'm great, I'm fine. So it's, we've got people in the state who were in the trials who have had it for even longer. So that's been great to be able to share. All right, Dr. Friedli, tell us about your work on long COVID, which I know seems exceptionally challenging.
Great, thank you so much. So I'm Jana Friedli. I am a physiatrist by training, which is a physician who specializes in physical medicine and rehabilitation. And I co-direct the University of Washington's post-COVID rehabilitation and recovery clinic, which is really one of just a handful of multidisciplinary clinics across the country that are focusing specifically on the longer-term symptoms associated with COVID. We started our clinic about almost a year ago now, and initially we were seeing patients who had severe COVID that led to hospitalizations and the wide range of complications from critical illness and prolonged hospitalizations that really benefited from intense rehab services. But then we quickly started seeing a need for people who had mild to moderate COVID who were recovering at home. Initially, who they were not hospitalized, but now have these ongoing, very debilitating symptoms months and months later. We've seen an incredible increase in the demand for our clinic services. When we started in the spring, we maybe had a handful of referrals a week, and those were primarily people who had been hospitalized. But now we're seeing 50 or more new referrals every week for mostly people who had these mild to moderate COVID infections initially, and sometimes up to a year earlier. And these people with longer lasting symptoms related to COVID or long COVID have a variety of symptoms, but as Dr. Getz mentioned, the most consistently and most extreme symptoms that we're seeing are fatigue, a very significant fatigue, headaches, impaired ability to think clearly, or what people describe as brain fog. We're seeing a lot of heart rate and blood pressure instability, poor exercise tolerance, and then all of these debilitating symptoms are then compounded by insomnia, depression, and anxiety. And this whole constellation makes it really difficult for people to return to work and participate in the activities that they want to do and that they need to do every day. So our approach in our clinic at UW Medicine is really a team approach that focuses on rehabilitation and helping people on a path to recovery rather than a path to long-term disablement. And so really, since these patients are experiencing physical and cognitive and emotional symptoms, we work with a variety of specialists and rehab professionals and provide comprehensive assessments and treatment plans that are individualized for people to help them address their most bothersome symptoms and try to get them back to work. So I think as you all have heard, there's a lot of ongoing research to better understand why people get these symptoms. So we don't have all the answers. We're learning more about what the pathophysiology is and how we can prevent these symptoms. Certainly, I would echo what's been said before, that preventing the infection itself is most important. But the current evidence and what is consistent with our experience is that a lot of the symptoms are related to this prolonged immune response that seems to set off a cascade of systemic inflammation and nervous system dysregulation. And so a lot of the approaches that we use and that seem to be most helpful are really geared towards reducing that inflammation and sort of calming the nervous system down and helping to better regulate. And from our experience, this takes a combination of strategies, and it takes a lot of time, which can be incredibly frustrating to people. But we're seeing a lot of success and a lot of improvement in people's symptoms with these approaches. And in terms of whether this is impending doom or worrisome, I think when you consider how many people have had COVID infections and the fact that between 10 and 30% of people with COVID infections are seeing longer term symptoms, the number of people with these kinds of issues and impairments, it's really staggering to think how many people have these problems. And there's clearly an unmet need for these types of services for people with these long-term COVID symptoms.
It also seems like it would be significant for our economic recovery as well if these folks are that many people are unable to return to work or to care well for their families, or whatever their work in the world is. That seems very challenging.
Yeah, absolutely.
Great, thank you. All right, with that, we will be happy to open up for questions, which you can put in the chat, or feel free to unmute yourself and ask a question. Okay, we've got a couple coming into the chat. Let's see. Is there any update on the counterfeit mask investigation? Sorta. The investigation is being undertaken by, let's see, Beth, please correct me if I'm wrong, if I don't have the latest information, but or Taya, I think you may be on as well. The investigation is being undertaken by Homeland Security and the Federal Trade Commission. We're not investigating since we don't do international crime. but we are participating very much. We've talked to both those organizations and the FBI and provided about 1 jillion documents to them. They are seizing the masks, and we also are working with our own insurance company, as I think are the other organizations that purchase the masks. 3M, as we've said, expedited an order from the Washington State Hospital Association for more masks, and a bunch of those have arrived and more are on their way. So we're very grateful to 3M for that, recognizing the sort of pickle that we were in and helping to help us find a way out that we could get more masks. There are a number of organizations that actually have been able to move back to the supply chain is stabilized enough and they've been able to move back to conventional PPE status. I don't know if maybe you all could address that, where you are in that, where you are on your PPE journey. That'd be helpful. Dr. Getz, do you want to talk about what's happening at Providence?
Yeah, we moved back to conventional use of PPE for masks and N95. That was, another phenomenal thing to see from where we were at, a year ago to where we are now, to be able to go back to use as they were initially intended.
Great. Dr. Friedley, how about you, Deb?
Yeah, I think we have a similar experience.
Great. And Catherine?
Yeah, we're in the same boat as the other hospitals, and just constantly watching that and making sure that our supplies continue to be sufficient as we go into what might be the next wave.
Great. And Elise, how about you?
Same. We continue to watch our supply levels, as we know that there's sometimes a delay, and we're still on allocation with pretty much all of our PPE from our vendors. So we're only allocated once a month. So yes, we're in a good place right now, but we look at it on a daily basis.
Great. We've had a lot of interest from our members in the masks that we are acquiring, the N95s, and especially the smaller rural hospitals that might have less access to a good strong supply chain. But I do know other hospitals are taking them and basically keeping them as backup. I mean, they're using them some, but also it's sort of a supplement to their supplies that I think is allowing more hospitals to move back into regular PPE usage. So that's terrific. Okay, question for Dr. Friedley. Are you seeing improvement in symptoms of long COVID patients when they get vaccinated?
So I think there's been a lot of reports recently of people who have had COVID who get the vaccine and seem to have improvement in their longer term symptoms. So we're certainly seeing some cases of that. I think there's ongoing research to really understand if that's a trend. I think importantly, what we're not seeing is that people are getting worse after the vaccine. So I think some people who have had COVID have a fear of getting the vaccine or wonder if they should. And our recommendation is that, yes, you should go ahead and get the vaccine. And we've really seen no cases of people with worsening symptoms after they get the vaccine. So I think that that's important. There may be very short-term side effects after the vaccine, but we're definitely not seeing any worsening of long-term symptoms at all.
Great. And are you recommending that your patients have 90 days or some is there some period of time between the end of their COVID infection and the vaccination date that you all recommend?
I think the recommendation currently is 90 days. Certainly people are getting the vaccine earlier than that. And we've seen lots of patients get the vaccine earlier and seem to do just fine with it. So I think the key thing is really getting the vaccine when it's available to you is probably the most important time to get it.
Thank you. Okay, a question about, with cases climbing up and spring break still ahead for many school districts, what are our concerns about the impact on the case count? Dr. Getz, how about you take that one?
Yeah, it's a really interesting question. When you talk about spring break and so, primary and secondary school and kids going home, in reality, that should actually decrease the spread of cases. When we look at influenza every year, we see a little bit dip or decrease in influenza when kids go on spring break because they're not, in school next to each other. So I don't quite have so many concerns about kids coming home on spring break. I think the behavior that concerns me are the college students that are going on vacation en masse to these destinations, and they're packed into a pool like sardines, then they bring it back to their communities. That concerns me a little bit more. But with the spring breaks for school-age children, I don't think that will translate to more hospitalizations or increasing case rate.
Catherine, how about you?
Yeah, the biggest concern is people who are not yet eligible for vaccine, who are gathering in mass, and that they may be leaving their community to do so, potentially bringing back variant strains to their communities that we're not even aware of yet. So I think as we continue to watch that, our big concern is that those who've left the area and are gathering in large gatherings. Certainly, if we start seeing gatherings of high school and middle school and primary age children, that would give me concern as well. But as Dr. Getz said, typically we don't see that because there isn't this large gathering portion to them. Often they're spending time with their families.
Thank you. And there's great travel guidance from both the CDC and the Washington State Department of Health about how to travel safely. And we're in beautiful springtime in the Pacific Northwest now. So hope, that drive with your family to a cabin someplace else and go hiking. Those kinds of things are great suggestions for people to be out and about during spring break. Hopefully not going to the beaches of Fort Lauderdale with, 8 jillion other people, because that is a huge concern. Another question. In terms of the next phase starting Wednesday, do we feel like this will make a big difference in terms of avoiding another wave, or do we need to get people vaccinated at a faster rate? Is speeding up the phases like other states have done an option? So I'll give an answer, and then I'd love for other folks to chime in. We are excited about the next phase. So we want this to keep moving as fast as we can. It continues to be supply is a limiting factor. I think that everyone on this call is going through their vaccine that they receive. We want to keep, I think 60-year-olds is fantastic because that's sort of the next group that could be at high risk. So, let's move along through them. We're hoping we get enough supply that we can accelerate the phases and really get folks vaccinated. Anybody else have comments about that? I think supply is, are you all having appointments you can't fill, or is it really supply that's your issue? Catherine, why don't you jump in?
Yeah, it's absolutely supply. We get our slots filled as soon as they're opening. We've gone to open scheduling online, which allows people to look for appointments that make sense for them. And we are consistently filling our slots. So the demand is absolutely there in the public. It's just a matter of assuring that we have those ongoing supplies so that we can meet the need.
Yeah, just one thing too, I think to mention, it's, we really have to continue working at getting vaccine into the BIPOC community. When you look at the mortality rates, they're affected disproportionately, and there's also a larger amount of vaccine hesitancy. So it's going to be really important to do that outreach to make sure that we have systems in place to deliver this vaccine efficiently and easily. That's one of the things I really want to continue seeing us work on as a state.
Thanks, Dr. Getz. Dr. Friedli or Elise, any comments about that?
No, I don't have a specific comment about the vaccine availability, but just to echo that there are disparities in access to care also for post-COVID symptoms and people who are experiencing those. And so I think as a state working on improving access for all communities, I think is really important.
Thank you. A question for you, Elise. How is vaccine reaching remote populations in Island County? And Dr. Getz, Dr. Getz and Catherine, you all both also serve communities that are more remote. You've got Chewelah, we've got Cedro Woolley represented here, San Juan Islands. So their systems are connected to hospitals in pretty remote places as well. So others of you could comment as well what you're doing to get out to rural and remote populations.
So we here at Island Hospital, we're actually part of, even though it seems like a misnomer, we are part of Skagit County, and we're serving the western part of Skagit County, and as well as partnering out on Orcas to serve the patients in San Juan County. So we've really been working with our public health here in Skagit County as well as San Juan County to make sure that we're publicizing when we're holding vaccine clinics. We're making sure that we're doing outreach. So not only do we have online scheduling, but we're also doing data mining within our EMR to find patients that otherwise may not be able to access the internet or computer or have some other barriers. So we're doing a lot of outreach using volunteers. We're using some high school students, volunteers to help do outreach and calling folks to make sure, again, we're hitting as many people in our community as possible. San Juan County has been the same, had great partners with their public health and the local clinic on the island on Orcas to organize a vaccine clinic out there. And again, just getting the word out and doing outreach and making sure, you know, we have an equitable distribution, but we're reaching as many people as possible. And to your point, Cassie, we have used each week, we've pretty much used all the vaccine we've been given. So the demand is there and the supply seems to be getting better. So it's good news all around.
And just to follow up on something Elise said, hospital electronic medical records are actually fantastic sources of information to identify people who need help. Because if you think about most people who have any sort of vulnerability will likely have been to an emergency room or an urgent care sometime in the last 5 or 10 years. And so as the safety net provider, you know, we have got just a ton of folks who are already connected, who trust that provider, who when they receive a call from the volunteer, even the high school volunteer, they've been to Island Hospital, they know the hospital, they hear someone calls them and says, hey, we'd like to get you vaccinated for COVID. You're a great patient of ours, come on in. That really is a great entree. And so we appreciate the Department of Health giving us permission to use the electronic health record as a reach out place, and actually think it's something that promotes equity because so many people use the ER.
It's been really helpful. And then again, as the phases have opened up, we've been working with our port to reach, again, the fishing vessels. We've been working with public health to reach the other employers whose employees, like the grocery stores, doing special days for those folks to get them in and out quickly. So really just doing a lot of outreach within the community to make sure we're getting to everybody that's eligible.
Thank you. Catherine, how about you? You all are in Cedar Woolley and San Juan Island, and you got all of Whatcom. You're the only hospital in Whatcom County, so you've got a lot of space. Longview, a lot of spaces that are actually pretty more remote.
Yeah, we have more remote, and then we also, of course, are serving those communities, those BIPOC communities, and wanting to make sure that we are getting them in as well. So we're using a trusted messenger campaign. So in partnership with community partners, we're doing short videos in different languages such as Spanish, Tagalog, Punjabi, and we're trying to make sure that we are reaching those communities that are traditionally underserved, both remote and in centers of population. We've also set aside appointments for some of our focused outreach for communities, and like in the San Juans, we have a partnership where we're having at the elbow support with community health workers to help get appointments for those people who might have barriers with the technology. And then when we're looking at our other populations, really thinking about how do we reach out and touch people who are influential and who are trusted in those communities so that they are able to get the message out that this is safe. Some communities have not historically had such positive interactions with healthcare. And so we want this to be an incredibly positive interaction, because getting vaccinated is how we are going to be able to go back to whatever is our new normal.
Thank you. Dr. Getz, how about you? You all are working in, you've got some hospitals in some more remote places as well.
Yeah, we have hospitals in Stevens County, Ferry County, and Ponderay. We're helping out. It's been a really neat cross collaboration through the medical community, and really trying to figure out how we can best vaccinate more medically austere communities. And we're seeing really, really nice uptake in rates there, and people getting vaccinated, and in some cases more smoothly than it's been going in our bigger population. So we've had people, especially in Stevens County, doing really nice work up at Mount Carmel and Colville and St. Joseph's and Chirula.
Great, thank you. Any other questions? I think I've gone through everything in the chat. Happy to take your questions orally. as always, we would love to hear feedback about if this remains helpful to you, if this cadence is too frequent. We've thought about going to every 2 weeks for these briefings, so I'd love to hear if anyone's got feedback about that. You could put it in the chat or send a note to Beth. Or if you've got topics, you requested the long COVID topic in Johnson & Johnson for this week, so we're happy to do that. If there's particular topics that folks would like to hear. Yes, Cairo 7 News, I'm not sure who it is. You said, can you ask a question? Please go ahead.
Hey, Cassie, it's Allison Grandy.
Awesome.
Hi there. It looks like President Biden is going to make an announcement coming up any time now, talking about the availability and access to vaccine across the country, announcing that 90% of the U.S. population will be eligible for vaccine by April 19th and will have a vaccination site within 5 miles of their homes by then. That is, previewing what it sounds like he could talk about. So take it with that approach. But what are your thoughts? I know you talked about trying to get through these different phases, but what are your thoughts about opening it more broadly sooner than May 1st in Washington?
So he's basically moving the May 1st, his May 1st directive back to April 19th. That's what the announcement's going to be?
That's not my understanding. I believe the rate states are going and how things are looking, and with your first advice, that looking like by April 19th, 90% of the country will be eligible. What are your thoughts for Washington?
So they've essentially taken what the other states' phases are and calculated where we'll be by April 19th. Okay. We're really hopeful that we'll be ahead of the May 1st everybody eligible deadline. I think we'd all like to be there. I'm happy for everyone else to comment on this too. I think it's a really tricky balancing act about wanting to make sure we're vaccinating those who are most vulnerable and most susceptible to hospitalizations. However, the states that are seeing an uptick are seeing transmissions fueled by people who are in that sort of 25, 30, 35 age range. They're not eligible, but they're spreading it. So, and as Catherine noted, we want people to stop spreading it. And the variants also have a chance to develop themselves the more infections there are. So I hope we can keep getting more supply and zip right through these phases and be faster than May 1st. Other folks, please chime in about what your thoughts are.
Yeah, there's no wrong person to vaccinate.
Yeah.
So the quicker we can get everybody vaccinated, the quicker we're through this.
We have considerably more. I mean, when I talk to my colleagues around the country, we have considerably more rules than most other states do right now about who can be vaccinated. Many states are this week or next week going to everybody. There's a lot of April 1st, April 5th states people going to, and anyone's eligible. Catherine, what are your thoughts about this?
Yeah, we are able to give vaccine if it's available. And so the idea of making more vaccine available and making it more convenient for people to get vaccinated is incredibly important. Reducing those barriers that are long travel, long waits for vaccine appointments, things like that. So, as we as healthcare systems partner with the public health infrastructure, the state infrastructure, and just making sure that we're all working together to get those vaccines into all of the Washingtonians who are willing to accept it.
Thank you. And I think, let's see, I don't know if anyone knows the answer to this, but I believe that the numbers that DOH puts out about vaccine that they're receiving continue to be the vaccine they control and not inclusive of the vaccine that's going directly to the federally qualified health centers or the pharmacies. Does everyone think that's true that still is what the DOH numbers are? Catherine, you look like you're saying yes. Yeah. So there's more vaccine. I think you all should verify this. I think in our state, more vaccine arrives every week than the Department of Health announces because it comes directly in federal allocation. So we're clipping along. Any other questions? All right, I really like Dr. Goetz's statement that there's no wrong person to vaccinate, and would also really encourage you all, this is sort of my personal crusade right now, to not use the phrase vaccines in arms, because it really isn't about an arm. It's about a human being that we are protecting from getting or spreading a terrible disease and providing an absolutely life-saving, easy, like, for all the other diseases that kill people, it's a lot harder to take care of. Think about treating someone with cancer or with heart disease, like those are big jobs. The COVID vaccine is fast and easy and might give you a headache for 6 hours or something, but this is of all the things we can protect people from, this is high on the easy scale right now. So I really encourage people to get it and to start focusing on the vaccine hesitancy and encouraging people to do all that they can to protect themselves.
Yeah, it's a really good point, Cassie, too. People need to realize, even if they're low risk for bad outcome from COVID, when they get vaccinated, they're protecting other members of their community that are at higher risk. So it's really doing it for you is also better for those around you.
Yep. Go see your grandparents or your parents. All right. Thanks a lot. Thanks to our panelists. Again, any feedback, topic requests, Beth put her email address in the chat. We'd love to hear it. Take care. Bye.